Good morning to you all. Welcome to this virtual workshop in this era of the pandemic. My name is Dr. Rajesh Tandon. I am founder president of PRIA, Participatory Research in Asia, which is a global research and training organization on community-based participatory research. I'm also UNESCO co-chair on community-based research and social responsibility of higher education. I'm delighted that you all have been able to join us in this very interesting session on sharing the results from a global survey that RING project undertook in 2019. We had actually planned this workshop to be a face-to-face event towards the end of March, and our plans got disrupted, like many others' plans, and so we found a way to at least continue the conversation that we began with several of you, and many of you have been part of it over the last several years. Now, responsible research and innovation is a phraseology that has been used in European Union over the last couple of decades. There are other manifestations in different regions and countries, including our own here in India, and several of you are perhaps involved in. I know one of our panelists has been in the discussion on scientific social responsibility as well of late. But essentially, the movement initially came from, science for society, which was like, let us do science which benefits society. But after a first round of conversation in European Union and some debates internationally, they've articulated it science for, but also science with society. And in this new articulation, the relationship between this world of science and the world of scientists and the various stakeholders in society, that relationship was expected to be two-way, mutual, and not just one way, not just communication of scientific results to citizens at large, but also engaging public engagement, and also bringing the questions of ethics in science, in research, the question of responsibility expressed through gender equality, through public engagement, and through communication in a manner that can be understood. Because historically, scientists and researchers in labs and in academia mostly converse with, and even today, mostly converse with their academic and research peers in languages that the peers know very well, but for the rest of the society, that conversation is only of recent origin. And therefore, the responsible research and innovation is a way of articulating new ways of doing science and research in today's context. And that new way seems to be even becoming more demanding as throughout the world we face this global pandemic in the last 4 months. The project, the RING project, which undertook this initiative, I'm going to request later our key presenter, Dr. Eric Jensen, whom I'm going to introduce in a minute. So the way this workshop is designed over next hour is that after I finish introducing the panelists, I'm going to, speaker and the panelists, I'm going to invite them to make a presentation. Now, the first presenter is Dr. Eric Jensen. He has been coordinating this global survey, and he will be sharing the results of the survey, in particular, placing India vis-a-vis the rest of the world, and what are the similarities and differences, if any. Dr. Eric Jensen is a senior research fellow and director of Policy Research Unit in International Consortium of Research Staff Associations. He's normally based in Cork, Ireland, but he was planning to come to India for the workshop and detoured via East Asia, so Southeast Asia. So he is now enjoying Southeast Asia for the last 3 months. Great to have you with us, Eric. Thank you for joining and agreeing to make this virtual presentation. Our main discussant, panelist, you call it discussant, co-reflector, is Dr. Shahid Jamil. Dr. Jamil is currently the Chief Executive Officer of DBT Welcome Trust India Alliance. This is for the last 7 years, but he's a researcher, he's a virologist, and he has been known for his very interesting research over decades on hepatitis and other related sort of matters. So welcome to you, Dr. Jamil, and once Eric finishes his presentation, then we will invite you to make his reflections, and given how busy you have been in the last 3 months, given your professional background, people have been drawing on your expertise nationally and internationally. So it will be useful to hear from you your reflections on what this RRI means in today's context, in India in particular. So without any further ado, let me invite Eric for you to make your presentation. For all of you who are listening here, all this is being recorded. You will be sent this recording after the workshop is over. Eric's PPT presentation will also be sent to all of you and will be posted on various domains and shared widely. As most of you may have participated in so many Zooms, you may know that there is at the middle of it, you will see there is a chat box, but don't use the chat box. We want to keep it for the panelists in case we have to tell anything. But you may kindly use Q&A, and after the presentation from Eric and comments by Dr. Jamil, we hope to have 15, 20 minutes for your Q&A, and we will respond to that. So here we go. Eric, welcome.
Thank you so much. Happy to join. So I'm going to dive right in by first kind of briefly introducing my background, and then the Ring project background, and then this topic of socially responsible research and innovation, before spending most of the time on the results from the global survey that we've been doing. So first, I'm a research fellow working on 3 different European-funded projects. So right now, most of my time is on the Ring project, which is responsible research and innovation networking globally. So that's the one you'll be hearing about today. The GRIP project, in case you're interested in following it as well, is a related project about instituting socially responsible research practices at the level of individual research performing organizations. So we are developing and implementing a raft of changes, and then evaluating the impact of those changes over a 4-year period. And then the Musica project is primarily an engineering-oriented sustainability project that also has a RI social responsibility dimension to it. My background is social sciences, so communication, and then sociology, primarily for my PhD. And the whole time, my kind of main focus area has been the science-society relationship. So the first project I started on while I was still an undergraduate was about biotechnology and the kind of social implications, ethical, legal, and social implications, which is one of the ways of looking at RRI. And then I publish in a mix of social science and natural science journals, and have worked across a lot of institutions, particularly around impact evaluation of public engagement. That's the kind of core area I've worked in for a lot of my career. So, and the hat I wear today is ICORSA, International Consortium of Research Staff Associations, and this is an organization devoted to trying to promote sustainable research careers, and to kind of encourage the positive movement in the kind of responsible practice of research through providing for better contracts and models for research staff. And then the RING project is a EU-funded project that is a 3-year project with a lot of partners from around the world participating, including UNESCO. And our kind of core end goal for this project is to arrive at a network of people who are interested and organizations interested in developing a more socially responsible relationship between the research and innovation system and society. So better alignment between society and societal needs and research and innovation systems. And the kind of unique aspect of this project compared to other ones that are happening in this space that are funded by the EU is that we're taking a kind of open global perspective. So this point that's bolded at the bottom, we're not trying to impose an EU definition of what socially responsible research and innovation looks like, but instead we're trying to understand how different research and innovation systems around the world make their work socially responsible. So how do they talk about it? How do they think about it? What steps do they take? And the idea is that we'll be able to learn from what's being done in other places around the world and bring that learning back to the EU, as well as kind of sharing it more widely in order to kind of get new ideas about how to implement socially responsible research practices. So one of the ideas that the project started with for one way to kind of create a shared language about socially responsible research and innovation was to look at connecting them to the UN Sustainable Development Goals, because this is a kind of global framework and something that, at least to some extent, people are familiar with globally. So part of the survey and also the interview research that we did was to test the ground to see whether the SDGs really have taken hold globally in the research and innovation space, and whether people are familiar with them, whether they see them as something valuable and something that's relevant to them, and therefore whether the SDGs could be a vehicle for kind of talking about socially responsible research in a shared way and using a shared language. So that's one of the things we're working on with UNESCO. And so now I'm going to briefly describe what we have been doing in terms of empirical social research in the project. So one of the major elements was structured qualitative interviewing, and we collected a lot of interviews with a sample across 20 countries that were as diverse as possible in terms of things like R&D spend per capita. And so we're trying to get a very diverse sample globally, both regionally and in terms of the kind of status of their research and innovation systems. And then conducted a lot of qualitative interviews. This is the kind of breakdown globally of where we conducted the interviews. I will not be presenting these results today, but the findings will be available within the next couple of months. And so at the end, I'll kind of highlight where you can see those findings and follow the project. So defining what our kind of scope is, basically there are a lot of different ways of talking about socially responsible research and innovation. In the US, for example, from the American Association for the Advancement of Science, which is one of the partners on this project, they tend to talk about socially responsible science as the term. Obviously, in the United States, there's also been terms like ELSI and ELSA, ethical, legal, and social implications, ethical, legal, and social aspects of science. So those are some ways of talking about it. In places like Latin America, there's different terms. There isn't kind of one term that's taken hold to describe this kind of thing. And then in Europe, because of the European funding kind of centralizing on this term of responsible research and innovation, RRI, that's the term that's really kind of risen to the top in Europe, but it's not that widely understood, and it's not a kind of commonly used phrase outside of people who work in this area specifically. So part of the project is kind of trying to establish a shared kind of common base so that we can look at these issues on a global basis, and we can work on them and network on them together in a way that works. So we needed some kind of starting point to define what we were looking at in the survey and in the interviews, and so we used two different frameworks to give us a kind of range of coverage of what could be included under responsible research and innovation, but then approach them in an open way so that we can be led by what people around the world tell us as their practices. So this first way of conceptualizing responsible research and innovation is known as the AIR dimensions: anticipative, inclusive, responsive, and reflective. So it includes things like that research and innovation practice should be diverse and inclusive, with early participation from a diverse range of stakeholders and publics to define the agenda, as well as for the actual conduct of the research and innovation. The idea that research and innovation should anticipate and reflect societal values and needs, because basically research and innovation are helping to shape the future. And then the idea that research and innovation should be open and transparent. So it should be open to public scrutiny. The methods and results should be put out in a way that others can view and assess for themselves. And then also the idea that there needs to be a responsiveness in how research and innovation operate, that they're responsive to stakeholder concerns and needs and public concerns and needs. So that's one way of understanding socially responsible research and innovation that we've embedded in the survey design. And then the other is the kind of official EU priorities, known as the policy keys for responsible research and innovation. And you can see here the list of topics that are included of narrow patchwork of areas of focus. The AIR dimensions are a more kind of expansive, process-oriented definition. And so basically we made sure to cover both of these in the survey questions. So diving into the survey, we developed the survey questions after a kind of extensive process of pilot testing that included a global sample of pilot testers, did 2 rounds of testing, and then we conducted the survey over a few months period, right at the end of 2019. And you can see here an example of how the survey was structured. So first, there's an attitude question, like, it is important to make data from my research and innovation activities freely available to the public. So that's a level of agreement attitude question. And then if people agreed, then they're asked, have you taken any steps to make your data available? If they say yes, then they're asked what specific steps they have taken. And that last question is an open-ended question that we are in the process of analyzing using a quantitative content analysis approach. And so we will have the results available from that within the next couple of months as well. We also gathered, as would be typical for a survey like this, a lot of contextual demographic information about the researchers and innovators who were participating in the survey, so that we can run inferential statistical analyses to look at whether there are any interesting patterns, not only geographically differences in people's responses, but also based on career status and the like, what countries people were trained in, et cetera, and as well as the specific area of science, technology, and innovation they're working in. So there's a lot of the contextual variables were included because this is really important for understanding differences and for the comparative analysis that we will be doing shortly. So these are the details. It was a very long survey, so we are very appreciative to our respondents for bearing with us on the survey length, and we got quite a large number of participants, including a wide geographic spread. And we have divided in terms of the geographical nature of the analysis. We've used the UNESCO definitions of world regions as the basis for doing geographical comparisons. And you can see those categories reflected here. So the Europe and North America are combined together, and then we have this kind of comparison. I'm going to get to the, whoa.
Oh, that's it. That's great. Beautiful.
Okay, so results. So we have here the comparison between India and other parts of the world. So you can see this is the level of agreement with the attitude statement. It is important to involve individuals/organizations with a diverse range of perspectives and expertise when planning my research and innovation work. So you can see the level of agreement with that statement in India is more strong. So the darker green is the strongest level of agreement than in other parts of the world. And that's the kind of main difference on that one. On the statement about gender equality, it is important to promote gender equality in my research and innovation work. Other than Latin America, the level of strong agreement with this was just slightly higher than India, but otherwise this is higher than the rest of the world, this level of attitude agreement with that statement. And it is important to include ethnic minorities in my research and innovation work. This one was less kind of strong, kind of clearly strong than the rest of the world, so about average, similar to the average level globally on ethnic minorities. So less strong attitude agreement than on some of the other aspects. And then this one is, it is important to ensure that the way I do my research and innovation work does not cause concerns for society. So this is anticipating societal concerns. And again, on this one, a bit less strong agreement that this is a priority in the India sample compared to the rest of the world. On the statement, it is important to make my research and innovation methods/processes open and transparent. Here you can see that the level of agreement is a little on the high side in India compared to the rest of the world in terms of very strong agreement. Then the next one is, it is important to make the results of my research and innovation work accessible to as wide a public as possible. This statement about accessibility to a wide public of the results from research and innovation work, the India sample had a higher level of agreement, strong agreement than the rest of the world average. And then on this statement about making data freely available. So this is about open data. The level of strong agreement was also a little higher than the rest of the world average. And same on the statement, research and innovation should address societal needs. So the idea that there should be a focus on societal needs in research and innovation work was also more strongly prioritized in India than in other parts of the world, including in the wider Asia Pacific region that India is categorized within. And the statement, ethical principles guide my research and innovation work, was higher than in the Africa sample, but about average other than that with the rest of the world. So the general picture that emerged from the kind of global research here was that these different attitude statements about these different dimensions of socially responsible research and innovation. Obviously, there's not time to show all of them here, but that was a kind of sample. That generally around the world, people agreed with these statements in very high numbers. So at the attitude level, there is a surprising amount of global agreement that these are important things for research and innovation. And then the place where we get a lot more diversity is the specific practices to translate those attitudes into kind of on the ground ways that people operate. And that's what we're looking at with the open-ended responses. So we're in the process of analyzing and quantifying those open responses now. But we're already seeing there's a broad diversity of different kinds of practices and different ways that people make their work socially responsible around the world on each of those dimensions. Things like gender equality, inclusion of ethnic minorities in research and innovation work, et cetera, et cetera. So then there's the question of SDGs. So the SDGs we found in the India sample, there was a stronger level of people saying that they're familiar with the SDGs, and people were more positive about the value of the SDGs compared to the global picture. So this indicates that the SDGs for India may be a decent basis. The UN Sustainable Development Goals might be a decent basis for talking about responsible research and innovation, because there's pretty high level of familiarity, and then also fairly positive attitudes that the Sustainable Development Goals are important, valuable, useful, essential, relevant, and beneficial. So that is the kind of overall picture. If you're interested in finding out what we keep learning as the findings keep coming through, this is how the Twitter feed and the Ring website, and more to come. Watch the space.
Thank you, Eric. Can you remove your share screen? Then we all can. Excellent, excellent. I imagine that trying to structure your presentation in 20 minutes with all this data from around the world. But thank you very much in terms of also highlighting comparisons with India, which will be of great interest to our participants today. Now, let me invite Dr. Shahid Jamil, as I introduced him in the beginning. He is the Chief Executive Officer of DBT Welcome India Alliance and Welcome Trust India Alliance for the last 7 years. More importantly, he himself is a virologist and has been an extensively productive researcher and awarded researcher over the last 3 decades. Shahid bhai, welcome. Your reflections.
Thank you, Rajesh. And thank you, Eric. It was very, very interesting as to what people think and perceive, especially in India, and I'll come to that in a minute. I think let me start by saying that there is definitely a need for responsible research and innovation, and COVID has shown it quite starkly why there is such a need. Responsible research globally translates into more innovation, more relevant innovation. And if you start talking about social innovation, there are 2 things that become that you would have heard quite a bit. And those are both very inexpensive ways of dealing with COVID. One is hydroxychloroquine, which has become very controversial. And the other is a study that was just published from yesterday, came out yesterday actually, from Oxford, where clinicians have treated people with dexamethasone and find that, in about 5 pounds, they can save lives of people who are on ventilators. So these are both examples of how something that is very inexpensive can be used to treat patients. And I use the word treat because I don't want to give the impression that these are things that people can start taking to prevent infection. There is no evidence of that. So keep that in mind. COVID has, people say that COVID has broken our health systems. In fact, what COVID has done is to show how broken our health systems really are. And that translates back to how responsible we have been in both our research as well as setting up of health systems. So today, for example, we have 8.25 million cases, 446,000 deaths. And this has happened in barely 6 months, less than 6 months. The virus that came before this, the SARS-1 virus, only infected about 8,000 people in the world. And why this has happened, there are hypotheses. Let's not go into that. What COVID has also done is to show how we selectively pick data. So we cherry pick data based on what supports our point of view, what doesn't. Since I have been following the Indian data very closely, let me give you an example. We say that in India, the death per million is very low, which is true. We say that the number of confirmed cases in India per million population is low, and that's also true. But when we come to the number of tests we have done, the same people who talk about per million talk about absolute number of tests. It is also true that India has done the least number of tests per million population than the top 10 countries in terms of numbers of cases. So this is an example of cherry picking data. You can't have one number as per million population and another number as total. And when you do that, that reduces trust. And we've seen how trust is so critical in controlling health outbreaks. The other point is about open access to information. Open access increases public understanding. It leads to better science. And this is made quite clear by COVID again. In the last 6 months, we have about 7,000 papers that are uploaded on preprint servers, which is about 4 times what is normally done in this period. The first virus sequence became available in the first week of January. Today, we have 46,000 genomic sequences that are available in open databases. And this being available in open databases allow people to do all kinds of analysis of this. And a very significant piece of work that came out of India, India was the first one to publish this, that there is a predominant isolate of the virus, or a predominant, I would say, variant of the virus that is slowly taking over the world. And today about 2/3 of viral isolates belong to this variant. It doesn't mean that this variant is less virulent or more virulent, or whether there are any implications for vaccines. None of that is there. However, it has shown how the virus is changing as the outbreak progresses. And this has only happened because we have thousands of genomic sequences that are being available in databases. What has also happened is in a very short period of time, the number of vaccines that are in the pipeline have never happened in history. So today we have more than 140 vaccines that are in the pipeline. About 10 vaccines have also already gone into humans in trial. The first vaccine that went into humans took only 63 days from the day the sequence was available to human trials, which is again unprecedented. It has never happened. So the way we are doing science is very different now, and that's largely because data is becoming more and more accessible. Uh, Two or three other points before I end. At this time in India, the science, technology, and innovation policy for the country is being set up. The last policy that was set up was in 2013. There is an exercise going on with right now, and a policy will be formulated very soon, and it will be put up for public discussion. So one request is that those of you who are interested in these things, once the policy is put up, please go and look at it and offer your suggestions. It's a very extensive exercise, and we are looking at something that will be relevant over the next 10 to 15 years. This will include governance, this will include funding aspects, how do you evaluate science, all that will be there. And I really think that some of the results that Eric showed would be very valuable to this group of people. So if I have your permission, Eric, I would like to share some of the outcomes of your study with the group, and we can talk about that later. Coming to India Alliance, we have two initiatives which I think would be of value to this group. One is that Wellcome Trust and three other founding partners started something called the Research on Research Institute, which is to do research on how research is funded, how research is carried out. India Alliance has become a strategic partner for this, and we are looking at research practices. And the very first project that we want to do is to look at our fellowship data over the last 10 years and ask whether we have any inherent bias in the way we are funding research. And if our research shows that we have any inherent bias, what might be the ways of correcting that bias. So that's one thing we're doing. The second thing that we're doing is we've launched something called the India Research Management Initiative, or IRMI, which has a scope which is sort of similar to ICORSA, which Eric spoke about. And through IRMI, we are educating institutions in India on good research management practices. And we are also helping institutes set up research management offices by award of RM grants or fellowships, and bringing people together from the International Research Management Network along with research managers in India. Finally, I was very intrigued by some of the things in Eric's survey. If I noted this correctly, you said that Indians agree most on diverse and inclusive research. This is very good news, but unfortunately, Indians don't practice this. They may agree to this, but they don't practice this. Indians agree much on open and transparent methods, and again, good news, but it has to be put in practice. And also that open access research is liked by most Indians. On the other hand, our hiring practices ask for impact factors of journals. And that kind of goes against this, this thinking. So I think we have much to learn, we have much to do. But I was also very pleased to see that Indians agree strongly with the Sustainable Development Goals. And it is time that we also align our science, technology, and innovation policy uh, with the Sustainable Development Goals. So I will stop there and then maybe look forward to questions later. Thank you.
Thank you very much, Dr. Jamil. Wonderful reflections from your long years of experience and particularly contextualizing it in today's context. Now, all of you who are participating, and there is a icon here called Q&A. I already see one question there. There's another one coming. Eric and Shahid, you can read those questions and then let people write those questions, and then we'll pick up one or two. There is also a provision, as you know, on Zoom, if anyone wants to make a comment or something, there's something called, you can raise your hand you know, so we can you know, invite within the time that we have. But we have some interesting questions already, and some information that Dr. Ravi has given a report here. Dr. Ravi, would you like to make any reflection here? Dr. Ravi Srinivas is part of RIS and the Science Policy Network. If you are around and you want to say something. Yeah, there you are. Please unmute yourself and share your reflections.
Yeah, actually, I found both the talk by Dr. Jalil and the earlier presentation quite interesting. See, RRI in both theory and practice is not something that is fixed. It is evolving and it could be contextualized for whether you are talking about the sector or talking about the country. For example, recent work on RRI has been not just on the typical research and innovation, but on large projects as well, and particularly on large technical systems. And our work in India, which we have shared just now, also indicates that yes, there is awareness about various aspects of RRI, although people themselves may not know what exactly RRI is about. For example, ethics is practically integrated in the research system in one way or another, either through ethics committees or through protocols or through IRBs, and then through the ICMR guidelines, and then various guidelines from BDBT and DST. Similarly, science education and science communication are also there, but they are not in the way with the Europeans approach them. And then coming to public engagement, yes, it is there, but not the way it is practiced in Europe. But when it comes to SDG, we also have been working on SDGs, and then we have a project on STA for SDGs where we are trying to figure out about STI's role in SDG, particularly in the Indian context. So I'm happy to know that people are aware of SDGs in India much better than other countries. In one way, it is good because it will help us to relate SDGs to the India's need and also to link up SDGs with our national priorities and plans. Overall, I find the findings quite interesting, and we would be in touch with the R&I team. Thank you.
Thank you very much, Raviji. Thank you. And you have sent a link which I'm sure we will all look at. Anyone else who wants to add any comment? Anybody? I notice, is Dinesh there? Would you like to make any comment? You have been very active in science communication.
Two small things.
Please.
Social responsible research. I don't think this country has identified what it is. Okay, this is one concern of mine. Most of our research is being funded by government, but I really am not very sure whether this research feeds back to the society or to the government. Okay, it is more of an open-ended research. So that's my one concern. So somewhere we need to, sensitize people what this research in, and at the same time sensitize the agencies to sort of look forward to these deliverables. This is one thing. Definitely, I do agree with the other comment, and which is also important to us. I mean, our hirings are really, I mean, I don't know, should we say that buying potatoes or onions, or I don't know how we do it. I mean, we are not very sensitively doing this job, and if we don't do that job, then again, we will not be able to sensitize our the students that we educate into this kind of social responsible research. Thank you.
Thank you very much. Thank you. Narayan Reddy, you've raised your hand. Did you want to say something? And where are you from, Dr. Reddy?
I'm from Anantapur, Andhra Pradesh, sir.
Okay.
Andhra Pradesh.
Okay. Your comment, question, whatever.
Yeah, I have even today morning I have sent 3 questions for you and Shahid Jamil sir and Dr. Eric Jensen for individual 3 questions for 3 people, because my core fight is almost very related to the social responsibility of science and innovation.
Okay.
I worked in pharma industry almost for 10 years.
All right. Those questions are visible. Our panelists will respond to whichever they can. Okay, I'm going to request Sheila. Sheila Patel is a leader of urban poor movements in Mumbai and around the world, and also serves on the Commission for climate adaptation, UN Commission on that. And we thought that somebody from grassroots experience may have a perspective on responsible research and innovation. So Sheila, a quick few comments from you before we hand it over to Eric and Shahid if they want any comments.
So first of all, Eric and Shahid, your presentations were amazing and extremely relevant to us. And the comments I want to make are threefold. One, let me start with a very local situation in Mumbai, where I live, and where we have in the Indian organization affiliated to the Shack Dwellers International, which is SPARC and STF and Mela Milan. Our largest constituency of communities that we work with is in Bombay. And what we have found is that, first of all, like you said, Shahid, COVID has really exposed the complete lack of preparedness of preventive and promotive health strategies in urban areas. All investments have been, even today during the COVID period, have been ventilators and ICUs, but very little about informing communities of doing things. It has also exposed the whole WHO crisis that refused to acknowledge that a very large number of poor people and vulnerable people live in informal settlements, and that there is absolutely no SOPs that acknowledge that poor people live in dense areas with no water, no sanitation, and cannot fulfill most of the general requirements to stay COVID-free. The third very important thing is that in an absence of direct communication with people who apply science and learn about communication that is useful to communities, the kind of fake news and terrible practices that poor people have been asked to do in order to prevent COVID, to take things to be better equipped to manage COVID, and the general fear of people of acknowledging that they have any virus which is related to the fears that you have when you had leprosy or tuberculosis, all have made people treat quarantine as if they were being sent to gas chambers. This was the first 15 days experience of people. So the complete absence of dialogue, communication is a very important thing that COVID explained. The other thing is your conversation about data. Just today in the newspapers, the municipal corporation in Mumbai has acknowledged that it did not categorize data properly, and so many deaths and so many infections were not reported, and this data was not provided by neighborhoods and by wards, and what impact that had on people. So that's the absolute day-to-day discussion, and Rajesh and others are part of a network where we all were startled at the impact of all the lockdowns and lack of preparation on itinerant migrants and their terrible journey to go back home and what has happened there. The other thing is to do with many of us who as grassroots organizations are supposed to facilitate dialogue between researchers and communities. And my community networks treat researchers like vacuum cleaners. They come, they suck knowledge from you, they take it away, and we never see them again. Those researches may be called participatory research, action research, all lovely names that are now very popular. But information, data, knowledge, and action possibilities are never, ever backtracked into communities. And so those of us who become intermediaries are now treated as bad gatekeepers that don't allow researchers to work with communities. And I think we need to change that. And a lot of what you said today is very important. Finally, 3 more things. One is both Eric and Shahid, you talked about being happy about SDGs being followed. I think now we have a double burden. We have to deal with the ability to comply with SDGs. We are not looking at the impact of not acknowledging the value of climate change that is further embedded than SDGs and can destroy our SDG trackings completely. And then when you overlay it with COVID and the way in which it's going to destabilize international giving, it's going to sharpen the divide between the North and the South in terms of how it's going to destroy Southern economies. So it triangulates into a very, very difficult situation within which the application of science in general, but also research and its impact on vulnerable communities is going to actually get worse in an exacerbated way. So what kind of alliances, what kind of networks we need to do across these different groupings is very important. Today, everybody is ready to give poor people a food packet. Nobody is actually ready to acknowledge that there are so many unidentified livelihoods, so many unidentified vulnerabilities that people are facing. We were going to face a cyclone recently in Mumbai.
Thank you.
And we were
Thank you, Sheila. That was very
so
helpful.
thank you.
Yeah, thanks a lot. Thanks a lot. Thank you for your thoughtful reflection. Let me quickly hand it over to Eric if he wants to make any closing comments, and then Shahid. Eric, please.
Thanks. Yeah, great comment. Thanks a lot, Sheila. So I'd just like to conclude by agreeing with what Shahid mentioned about the fact that there is and will be, not only in India but in every country, I assume, a gap between attitudes and practices, and that's completely to be expected. It's kind of very typical, and it's something that I think is our kind of zone of action to work in. So I think I would like to see this in a positive way, that the fact that we have high attitude agreement, even if people's practices are lagging way behind, at least that's an opening to then be able to support people to realize the kind of aspirational attitudes in their actual research and innovation practices.
Thank you very much, Eric. Very, very helpful. Shahid, any closing reflections?
Yes. So I think what Sheila said is very true, and truly the picture that we are seeing today. I'll pick on 2 points that she mentioned. One is communications, and we've seen poor communications at the root of many problems that we have seen emerge in COVID. And Poor communications is not just limited to India. Poor communications at the level of WHO. We have seen how WHO first said that masks are not needed and then said masks are needed. Just a few days back, they said asymptomatics are not transmitting, and then couldn't figure out whether they meant asymptomatic or pre-symptomatic. And then they withdrew that statement. I mean, complete, loss of communication from an agency that is supposed to be communicating well. In India, we still don't accept that we have community transmission. We have 350,000 plus cases, and still the head of ICMR goes on television and says we have no community transmission. It beats me how all this figures out. So my observation is that in COVID, we have essentially converted a public health problem into a law and order problem. And pandemics can only be controlled by trust. They cannot be controlled by danda. And we are using the wrong approach here. How do you explain social distancing or physical distancing to somebody who is worrying about his next meal? People have done estimates to say that if India were to practice physical distancing at the levels prescribed internationally, India would need 7 times the land area that we have today. So we have to, really clearly communicate what is needed of our population. And Sheila very correctly said that we are telling people to wash hands with soap and water. Many people don't have either soap or clean water available. I mean, what are we talking about? So these are really gaps, and we really need to be working on these gaps. What effect COVID has had on health systems, we don't really know yet. And this is something that we are also, we've also set up a partnership very recently to look at this, to look at the effects on health systems, to look at the effect on mother and child, maternal and child health programs, to look at effects on immunization rates, effects on NCDs, on TB control program, all of this. I'm sure many others are looking at it, but it's really the need of the hour, because we have an opportunity here. COVID came, it gave us a challenge, but it also gave us an opportunity to really learn from what we have done wrong and what we have done well, and really build our research networks and our health systems accordingly. So that's my final comment. I hope we learn from this and as we go forward.
Thank you very much, Shahid. Now, thank you all. I want to just pick up 3 messages that I found very interesting from the conversation today. The first, I think Eric's presentation gave the message that there is a normative or attitudinal acceptance of some of the principles of responsible research and innovation in India, among the Indian researchers, research policymakers, research funders, even among some of those civil society groups who were involved in this data collection exercise. But the gap between the normative acceptance and the everyday practice, I think, is a question that Shahid pointed out, others have pointed out too. And it's on the one hand a gap, on the other hand it's places for improvement in our practice. And the practice is partly policy, but partly everyday organizational framing. Our criteria, our methods, our tools, in a way which take us towards more responsible research and innovation. The second sort of key message that comes out is that how the current situation of the pandemic has demonstrated the importance of building over a longer period of time bonds of social trust between the world of science and scientists and communities at large. Because in the absence of that, these kinds of pandemics and even situations which have arisen in parts of the country, whether it's a disaster caused by cyclone or a locust attack or a distress of any kind. You know, what we have a research institute on locusts, and I've been reading the pronouncements of its DG, last month. But the farmers who are supposed to deal with it don't have an idea what he's saying, and some of the farmers began to say that this was a Pakistani conspiracy that locust was sent to Rajasthan. Shahid would remember, several of you would remember. And nobody to say what is a locust, where it has come from, what can be done to prevent. And people are just spraying pesticide or locusticide on anything that they can find. So this requires longer term ongoing effort on the part of the scientific community and research enterprises to be able to build that social trust over a period of time. The agricultural scientists with farming community, the health scientists with the health workers and their everyday practices. The third key message, of course, is that the offer that Shahid made, I think all of us should take into account this research that Eric has shared and some other follow-up research that will come out of RING project. We will, as Shahid has said, request you to take it to the members of the committee who are involved in framing the new policy, STI policy, but also an invitation to all of us. Practitioners don't engage with these policies normally. So Sheila, people like you and us and many others should also engage in the formulation of this policy. This is the time, and there are lessons from this. So thank you very much, and we hope that within this country we develop a broader fraternity, a network of researchers, research institutions, practitioners, and science communicators who want to work together towards a more open, more responsive, and more trusting science and research in the coming period. Thank you very much. Thank you all. Special thanks to Eric and to Shahid. A word of thanks to Sheila and my colleague Jigme to making it possible. And thank you all. You will all receive the recording. You will receive a brief report and the key messages, and we will continue dialogue with you all. Thank you for your time. Thank you very much.